I'm going to introduce Jerry Mendel and Linda Wright. Jerry is from Nationwide Children's, and so is Linda. Linda is a pediatric cardiologist, and you might know Jerry from been with Nationwide for a very long time, and he's done amazing studies from leading the recent Templerson study and many others around there. Linda and crew have been working on the cardiac implications of Duchenne, and we initiated with them a carrier study. So I'm going to let them talk about it, describe it, and if you have questions, please answer.
Thank you, Pat. It's an incredible honor to be able to do this study with PPMD support. And what I'm amazed at is after all this long day, we still have quite an audience here. So I'll be brief because really what I want to talk about is specifically what we're doing in characterizing skeletal and cardiac impairment. And I've asked Linda Wright to come up here to address some of the cardiac studies. What we're trying not to do is to be redundant over what's been done in the past and apply new tools to looking at the characterization of the carrier state. So the targeted population are the mothers of boys with DMD carrying the mutation for DMD. And just to be clear about it, there are really two types of carriers. There's the germline carrier that can't be detected through usual blood tests because the mutation really is in the ovary. And but we are very interested in that population. And we also, of course, the more usual carrier are the somatic carriers that can be detected just like the boys with Duchenne dystrophy. Enrollment criteria are basically simple. We must identify a mutation in the mom of a Duchenne patient. And this can be relatively easy to do because the boy will have a mutation in the son of the mom, and by having that available, we can do targeted mutation analysis with PCR and cut down on the cost incredibly. And the other thing is many of the mothers who are interested in carrier detection and characterization, really, it's not detection so much as characterization, have already been tested. And I just brought this picture up here. In our clinic, which is one of the approved clinics that Kathy Kinnett has worked so hard on, we have weekly DMD schedules. And you can see that every week we have a schedule of the DMD and BMD boys that are coming to clinic with their mutations. I have the names deleted here. And we have the parental status of each one of those. In this particular clinic week, I just picked out one. We have 8 patients. 2 are Becker and 6 are DMD, and all of them have mutations. So this would be an enrollment that would go very rapidly for our clinic, and actually we're starting the study next week, and we have 3 patients, 3 moms who have volunteered for this study. The study has to be consented, so these are volunteers, but we're very interested in their mutation and how their characterization looks. So the study objectives are how many of the moms are affected by carrying the gene, and what's the mechanism causing cardiac involvement, skeletal weakness. And I want to emphasize about stress. Stress is very important in the carrier state. And so what are the treatment possibilities for these 3 manifestations of the carrier state: cardiac, skeletal, and stress? The major considerations are can the identification of what we're going to look at, and I'll show you in a minute, can that lead to treatment? Does it mandate treatment, especially for cardiac disease? And the skeletal muscle weakness is also an important consideration, because we all know that caregiving is a major challenge, and weakness for the moms can create problems. And then are there any potential treatments? And really, it's this. There are really two aspects of this stress for moms who have the carrier state. One is related to the hope of unfulfilled related lack of DMD treatment, and that's one of the things that we're trying to address, and Pat gave an elegant review of that this morning. And then also the stress for loss of function in mothers. If mothers have loss of function themselves, they have trouble taking as caregivers, and as caregivers then that creates even a circular problem in terms of stress. So the study design is we're trying to use new tools to address these questions. And there have been a lot written about these over the years, but the real numbers are not available. And we'll use cardiac magnetic resonance imaging to establish the incidence of cardiac disease and define the most distinctive changes compared with age-matched controls. And I asked Linda to come up here. Linda is the head of our cardiac Duchenne and Becker muscular dystrophy program, and she's the one that designed the cardiac study. So if you want to make a few comments about that.
I mean, I think... I think that it's well known that the maternal carrier is at risk for developing cardiomyopathy, but we don't know what that risk is. There have been a number of small studies published throughout the years in a variety of different centers that have sort of put the risk anywhere between 10% and 75%. And so what your true risk is really unknown if you're a maternal carrier. We do know from the looks that we have done is that the cardiac disease in the young men is exactly like the cardiac disease that we're seeing in the maternal carriers. And so, I think we have a lot to learn about how to take better care of you, and what we may learn from you may be very important with regards to knowing how to better treat your sons. And so I think that, to me, this is a real important study with regards to being able to understand Duchenne in its entirety a lot better. And I'm more than happy to talk to anybody after the presentation in greater detail if you'd like.
In addition to the cardiac studies, we'll want to define, let me leave that. And we want to establish how much skeletal muscle involvement there is in DMD carriers, the degree of disability, and the alteration in the quality of life. These are the things we're really trying to address. And establish the incidence in the DMD carriers of stress and cognitive defects that may correlate or may not correlate with cardiac and skeletal muscle involvement. We'll have, the initial enrollment will be 150 patients who have, or moms who have the somatic mutation that we can identify in the blood. We'll have another 50 with germline carriers, and then another 50 healthy controls. And I think our biggest concern really are the numbers. We have a great deal of volunteers already, and we welcome others from other places. This is the DMD characterization, just to give you an overall view of it. Obviously, there'll be a medical history, and then we separated the neuromuscular, the cardiac, and the cognitive stress factors separately. We have a coordinator who can put these together either on one day or multiple days, depending on the family. Since mom is a critical person in the care of the Duchenne patient, they may not be able to devote 1 or even 2 days to this process. So we have a coordinator who's working on this. There'll be, for the initial study, there'll be a baseline test, a 1-year follow-up, and then a 2-year follow-up. So we'll have 2-year data, so we'll have both initial characterization, and then we'll have a look at longitudinal changes. So this is the contact information at Nationwide Children's Hospital, and I think I'll ask Kathy to make this available. Marcus McCauley is a very responsible care coordinator in our center. Samuel Zaidi is the titular head of the characterization study, and I'll be glad to address this with any patient. So I'll open it up to question after thanking PPMD for making this, what we think is a very important study possible. And I think that
we've been talking about this is because there are in this country that we know of about 10 or 15 young women who are 14, 15, 16, and they have Duchenne. You might know one of the famous ones that has had her heart fixed with a LVAD from Cincinnati Children's. Her name is Susie, and she's all over Facebook and doing quite well. But you worry about these young women and say, if and when, I should say when, not if, treatments are available, will those labels reflect the fact that females could have Duchenne and should have access to treatment? When gene therapy comes along, will they be candidates for a gene therapy? So I know the females feel left out. In fact, we've had these discussions all along. And when we talk to them, sometimes they go to many different clinics and often are treated far differently, from yes, we'll intervene with steroids to no, we won't intervene with steroids. No, we'll look at your heart, yes, we will. So we felt like really focusing in on a study with Nationwide would really give us the opportunity to understand female carriers, to understand the stress, the cardiac and skeletal muscle risk, and hopefully enable labels to be broad and include any individual with skeletal muscle manifestations that is amenable to this therapy should have access, and it should be covered. So that's why, and I hope if you're a carrier, Annie?
Can participants be adult sisters, not just moms?
So the question was, so what we're hoping is that families will come in of moms and sisters and aunts and cousins, and they will all be involved in the study.
Yeah, I mean, I don't think you have to be a mother of a Duchenne boy. You could be a sister or a female carrier.
thank you for clarifying that. I should have had that on the slide. Thank you.
Mindy?
Hold on.
Hold on. Are you looking for family members that may or may not be carriers?
We would, that would help the study a great deal, absolutely.
So they would get the MRI and all of the testing too?
Yes.
Okay, thanks.
They need to be genotyped though, right?
Yeah, we would have to genotype them as part of the family. But we have the mutation, so it should be very targeted mutation analysis.
The two questions I've been asked the most this week are, is genetic testing involved or a part of this process and involved in the study, and travel, the cost of travel included?
They have to be tested for inclusion in the study, absolutely. We have to know, but we'll have, in most cases, we'll have a mutation. Could there be a situation where there's not? Yes. And if that's the case, we'll have to do more extensive MLPA analysis or others. But in most cases, we found, we started this thinking that we would have to do MLPA on a number of patients and maybe sequencing. But as soon as we started looking through our clinic, we had an incredible number of boys who had the mutation identified, and then the targeted mutation. But there could be a death in the family or whatever that results in a Duchenne patient that didn't have mutation analysis, where we'd have to move on to a more extensive analysis.
But we will do that analysis as part of the study.
Yes, that's part of the study, definitely.
And our traffic signs included in the study.
Yes.
I just had a question about if there are any exclusion factors. For instance, I'm a carrier with cardiac symptoms and already on medication, so are you wanting to look at hearts that are, untreated or treated? Or?
No, so you're a carrier, if I missed it, you're
Yes.
a carrier who already is having heart problems. Oh, then we come on down. I don't know what kind of testing you've had, but we may repeat some of the testing so that we have that data at our own institution. But I think that, I think that, to me, my bias is that there's a lot of female carriers who have cardiac issues. Now, you're not going to manifest them clinically, but we've scanned a number of carrier moms who were curious, and we have found disease in a number of them. So I think if I had a guess going into the study, my guess is that we're going to find an incidence of heart disease that's higher than expected. But as part of the study, we're going to not only do cardiac MRIs, we're going to do EKGs, and we're going to do stress echoes. So we're going to put you on the treadmill.
The treadmill test, but so it leads me to another question. If we've had this testing other places, and we have continuous, appointments where it's checked and monitored, can you use that data, or do we need to travel to Columbus?
Yeah, I think I'm interested in your data, but we actually, as part of this, want to collect the data in a very uniform way so that there's integrity with the data collection. Sure. And none of it is painful or it just involves your time.
Yeah.
And bring your tennis shoes.
Okay.
I can talk to you later about this, but you have half my testing done. So I was one of the curious moms.
Yeah, so if we have your cardiac MRI data there, that's actually really interesting. So what do you think about that?
If it's already been done?
At our institution.
Yeah, I mean, if
I
it's
think
done
we should
by
be able to,
Congress,
I think we should be able to use it. Then we just need to add the additional things that we don't have.
Yeah.
I have two questions. One, how often would we need to travel to the study site for testing?
Only once a year, right?
Yeah. Follow up at baseline, follow up a year, and then follow up a year later.
So 2 visits. 2 visits to wonderful Columbus. Make it in the summer.
Well, 3 visits. The baseline is important.
Right. And then, are you doing anything to control? It seems like a lot of moms who are already having cardiac problems may be more interested in participating in the study than some of us who are not. I'm a carrier. I had a cardiac MRI. Everything looked normal. So is there going to be some way to make sure, just, for a numbers perspective, because it seems like you might have more moms drawn to a study like this who are having difficulties and want to know more information?
I think that is a risk, and we'll have to look at the risk analysis, and we will address every single patient in our clinic and invite them for enrollment. So we'll have some longitudinal analysis, patient by patient, and then there could be a separate group that comes in elsewhere with identified heart disease.
And to me, I think that, we know, and it's been documented in the literature, that this population of people is at risk for the cardiac disease. What I think, to me, as a cardiologist, is much more fascinating is the skeletal muscle manifestations of the disease. And, the associated muscle pains and weaknesses and cramps. And I also think that the psychosocial aspects are also critical. One of the things that has been documented is the incidence of severity of heart disease associated with stress. And so one of the things we're going to be doing is checking hair cortisol levels to look at stress levels and try to correlate those with the manifestations of physical symptoms. And looking at psychosocial parameters as well, the impact of the stress of just being a carrier. And so I think there's a lot involved in the study. It's an amazing endeavor by PPMD, who sort of pushed us to do this, and we're thrilled to be able to participate. But We spent a long time trying to think through it, trying to make it a very cost-effective collection of data. What do we need to get? What don't we need to get? So I hope we have what we need, because we put a lot of thought into it going forward.
I just have one more question. Are you finding that as women get older, they might start manifesting symptoms, or do you see the symptoms right away in young moms? Because I'm just thinking a baseline 1 year, 2 year, you might not exhibit symptoms for 20 years or 30 years. I mean, I've always been a carrier, never knew it, and never knew I had a heart issue until I was 50. So I don't know how the baseline 1 year, 2 year figures into that.
That's a great question, and I'm not sure that we will have the answer because most of the mothers are young. And so as far as, I think we'd have to really be studying mothers who have really, in an older population, and I think maybe that'll have to be a follow-up study. I just don't think we can fully address that.
Well, it's also a population snapshot, right? I mean, we're going to have some moms in the study who will be 60, some moms in the study who will be 50, some moms in the study who will be 40. So we're not going to get your longitudinal data, but hopefully we're going to, get 200 individuals who will give us a snapshot. And like Jerry said, I think that what we find hopefully will lead us to additional studies to potentially target better understanding and maybe even treatments or thoughts.
And just from talking to carrier moms in my 12 years of being in the community, the skeletal muscle particularly affects us as we get older. Like, I was strong as an ox when I was young, but I totally have exercise intolerance now. Never had it before. So that's something that's kind of accumulated over the years. I
mean, I think as a non-carrier mom, that really hits me too at 50. So, I have one part of it is just natural aging, but I think it's an important question, and it's something that we really need to look at. And I think, to me, the exciting thing is, I think that this is, if you spend some time on the internet and look at PubMed references on the Duchenne carrier and what's known about the Duchenne carrier, there's really a paucity of data. And so I think this is going to be really important data, and I'm optimistic that we're going to find important things and things that may help the boys.
Thanks.
Other questions? All right. Well, first of all, thank you so much for sitting all day and for being so patient and listening. Right now, we're going to hopefully feed you, to give you something good to drink, and it will be inside of the atrium. So we'll see you again tomorrow.